Big ideas right now can change the world. Yeah. Just this moment right now can make a difference. Yeah.
This programme is called the Transforming the Community Health Workforce. It's an exchange programme of mutual learning between Homa Bay County in Western Kenya and Liverpool.
Usually we talk about south to south learning, but in this case it's a learning exchange between the southern hemisphere and the northern hemisphere. So it's south to north and north to south shared learning.
Can make a difference.
The idea behind this project is that Kenya and Homa Bay County are quite advanced in community health programming, while on the other side, Liverpool has elaborate primary care networks. So UK as a country has had primary care networks for a long time. So Kenya is currently trying to implement primary care networks, and Liverpool is currently trying to improve its community health program.
It's focused on the community health workforce, and we've paired up 6 individuals at those different levels, from Director of Public Health level to medical services, to youth advocates, to people working with vulnerable groups, to community health leads, to create changemaker pairs.
I'm very excited to be here. I want to learn more about community health implementation here in the UK.
I've been to England many times, but I've never been to Liverpool. I'm just beginning to wonder, why didn't I come to this beautiful city?
So for me in Liverpool is to see what are the convergence areas in the context of community health. What are the new things that are happening here that is not happening in Kenya, and what is there in Kenya that my counterpart please can actually learn and implement.
Basically, my expectation for this week is that we'll be better off than we came by exchanging what we know, what we have, our experiences, but more importantly, to know what is happening here, especially under the space of primary healthcare networks.
So when we're thinking about the structure of the NHS, what we have is the Department of Health and Social Care.
We started with an overview of the UK health system. We've done community visits, we've visited organisations, and we've also done health centre visits and the emergency room. The Lord Mayor hosted us in a civic reception. We actually took them around the School of Tropical Medicine, exposed them to some of our research and academics. The snakebite tour was a great event. We held a mini symposium here with academics. People have done shadowing of their counterpart, spend the day with them, see what their day-to-day job is like.
Let us break boundaries and dare to be different. Oh, different. This is not a paper exercise. It is everything that we need right now.
The week has been good, a very busy week, a lot of learning. Learning from the culture, connecting with people. So it was a very good week and a busy one as well.
It was so boss. But what I've learned is how organized the workforce planning is. I was just telling Melissa, so her team is really a tight ship. So I just want to borrow those lessons and go back home and work my team into the tight ship that I have seen. We shake hands. Hello, how are you? Good. So please expect this.
There are a lot of areas where we converge in terms of ideas, in terms of practice, and also areas where we also need to, the UK needs to learn from Kenya also.
Yes, so we have the exchange. We'll be going to Kenya. I'm going, and I've just told Emily I want to go to the community. I want to see how those services are provided, but also see what the community is like, what are the needs, what is the uniqueness of them, and how the healthcare providers and community health promoters, how they tailor their work to make sure that they can deliver best quality care and best quality support to the communities.
Yeah, really excited. So we've been asking Lynette and Emily, me and Dagmara, all week about different questions about Kenya and what to expect from Homa Bay. But everything they've told us sounds amazing. So we're just really excited to get over there and see how they work with their communities and what learning we can bring back home with us back to Liverpool.
What was happening this week is that we were having an exchange visit from a team from Liverpool City Council coming to visit Homa Bay County. So the program was structured around change maker pairs, and so for each visit there was time set aside for change maker pairs to shadow each other.
Most of all, I was very excited to come. We've been hearing about Kenya for maybe the last 12 months through the Liverpool School of Tropical Medicine and the projects that Kenya and Liverpool share.
I had the chance with the LVCT to go into settlements in Nairobi and see how the community engagement and community mobilization and advocacy looks like on that level. And then obviously we've managed to come into Homa Bay.
I think hearing it and seeing it in real life is very, very different. So it's been really interesting today to attend with the healthcare facility and obviously to come and see the community health workers out in their communities.
And I also think the fact that we are using community feedback to inform how we offer services. I think that's a similarity, different context, but I think that's what we are all passing.
And if you look at the dream of the PCNs in Kenya is exactly what is happening in England. Every citizen should know, when I get sick, what is this primary network that I am in? Which is the next facility that I should go in, or I should go to? How is the referral system, both upwards and backwards?
People here really support
football,
Premier League and support football.
I know that.
So the best practice, like in your facility, the way you've integrated sporting events into young people and also reaching to young people, that's also another thing that we can learn. So that we try to use sport as a tool to mobilize young people to affect services.
With us, we use sport and the arts and creativity. So we do a lot of creative activity with our young people. We've built a 3G football pitch. We're now building other facilities there. That is for young people and adults and everyone else, because we also see that as part of well-being.
You guys have a more engaged community outreach team, so I think there is a potential to learn how we could incorporate elements of that.
Yeah, I think it's very important to share ideas from the global south and the global north, and they just share these experiences and learn from each other.
Big ideas right now can change the world. Change the world,
I mean, this is just putting a toe in the water, really. It's the beginning of doing work this way, learning from the global south, having mutual exchange.
We are very happy to see that both teams learned something from each other. So for example, the Kenya team were able to visualize and understand how primary care networks work. The Liverpool team were able to take away a lot about our community engagement, the real engaging the communities, the community health workers being empowered.
The shadowing is especially fantastic because the experience is very organic. We are not in a classroom setup, we're just out there doing our work and then getting to experience each other's work. It's just been amazing.
We already have intentions to hopefully meet again this year to work in collaboration about how we can embed some of this work into Liverpool's way of working. We've talked about other potential projects that we might be able to work on. And then there's the opportunity for us as individual and professionals to work together to share learning and growth along the way. And all of this has been made possible by this project.
Right now, right